My name is Yasmina, and I'm excited to welcome you to the Pacific Southwest Mental Health Technology Transfer Center's new program, Rising Policies and Practices in Our Workforce. It's our spring and summer learning series, and we're so glad to have you join us, whether you joined us last time for our session about the rollout of 988, or you're just joining us for the first time. We are so grateful to be funded by SAMHSA. An overview of what brings us here. And then we're going to hear from regional and one national experts about rising practices and policies that bring us hope and caution. Our series supports the school and broader mental health workforce. Many of our panelists today come from a particular school-based or community-based context. We invite you to transfer or translate their sharings to your own context. Today is the second session in our four-part series. We are here to listen to regional leaders sharing opportunities and challenges that come up when we witness or experience war-related violence and harm, past and present, and how that might impact or activate experiences that we as providers give, or the experiences that the children, youth, and families we serve. So how does the outside world impact how we provide services, and how does that impact the people around us? In recent months, the war in the Ukraine has heightened our national attention and discourse around war, supporting refugees, and more. Our region, specifically the Pacific Islands, Hawaii, California, Nevada, and Arizona, hold a diversity of experiences. Military-involved refugees, asylees, and a range of documentation, narratives, and stories. This conversation assumes that children, youth, and families in our region have or are witnessing war via media, via their own family histories, and that our dialogue today is about how we can mitigate the distress that comes from that witnessing or getting activated. And finally, each speaker offers their own experiences, truths, and practices to inform policies and bring our regional leaders to expand the conversation. Our panel today is so rich with diversity of roles, perspectives, and experiences. You'll be hearing from Natasha, Stephanie, Jose, and Sharon. And I just want to say welcome to all of you. Wave. Each of our speakers will share their responses to our guiding questions. And then at the end, we'll have time for Q&A.
I am a school psychologist. I've worked in New York, Philadelphia, Baltimore, and currently I'm working in Los Angeles. And I work predominantly with low-income youth from a variety of backgrounds. I've mostly worked with Black African-American students, and currently I'm working predominantly with Latino American students. So one of the reasons that I'm on this panel is, apart from my work as a school psychologist in the public education system, I'm also an immigrant from Ukraine. So here are some photographs from my experience. With my brother and my mother, I was born in Yalta in the Soviet Union, and the Soviet Union fell apart in 1991. And in the summer of 1993, my family immigrated directly to San Francisco as Jewish refugees. So in the United States, I identify, when people ask me, as a Russian Jew, Russian-speaking Jew. So ethnically, on my birth certificate in the Soviet Union, it says that I am Jewish as my ethnicity. But here in the United States, I identify as Russian, but born in Ukraine. Okay, so one of the things that I wanted to talk about is the first part is, what are the fundamental elements to providing care? And I'm going to share a story and experience that I had in one of the schools where I work. When I was working in a public school system in 2017, we had a student who was a war refugee from Syria. Prior to that, she spent 2 years in a refugee camp in another Middle Eastern country. And when she came to us, she was having some difficulties with her classmates. She wasn't fitting in. They were touching her hair. Her mother had to put her hair up in a bun for the first time ever instead of letting it flow down. And she started getting into verbal arguments, cursing and verbal aggression with the students. So the school team immediately called a meeting with her family and her teachers and an interpreter. So in the meeting, one of the staff members had expressed, we're in a low income, high crime area. Our students experience a lot of gun violence, and a lot of the statements that your daughter is making are triggering our students. And the interpreter, instead of translating that to the family, immediately said, you know, we've also experienced a lot of trauma. And so she felt like we were coming into the meeting almost accusing her daughter instead of hearing her story and where she was coming from and everything that was happening with her family, who actually was not allowed into the country at that time. So as soon as we received that statement, we reshifted the meeting and we reframed it, and we did not force her to share her story, but we just let the parents talk about their daughter, like how they know their daughter, not any sort of misbehaviors that she was demonstrating. And after that whole conversation, because their daughter was present, she was a fourth grader in the meeting, and she said, you know what, I've really enjoyed this meeting. I hope you can come over to my house for tea, right? And she was feeling a much stronger connection to the staff there instead of just being known as this immigrant student who was cursing at her American classmates. So I think what we did well was, instead of continuing with the meeting that we had planned, we shifted the conversation, really focused on her strengths, and allowed the parents to just talk about their daughter as they know her. I think what we could have done better was not come into the meeting expressing and accusing the daughter, but really just saying, have you noticed these behaviors with your daughter at home? What kinds of shifts have you noticed? Is there anything you feel we as a school team should know? And I think it's important to realize that we can't make assumptions about where someone's coming from or what they've been through. And we certainly should not be comparing experiences, right? Because it is true that the students that I was working with in that school were experiencing trauma, but also we have to recognize the experience of the student who was a recent war refugee. So although I came as a Jewish refugee to the United States, I did not experience an active war, and my family did experience anti-Semitism. But I think we have to recognize, and what I learned from that experience was, even though we're both came to the United States as refugees, we had very different experiences. So what are some ways that we as therapists and clinicians and social workers or even educators can work in such situations? So I wanted to share some quotes with you that some of my colleagues have. I've heard them say, and that inspired me. So one of my professors, a clinical psychologist, Dr. Ri-Chun Huang, said, we really have to pause to be responsive rather than reactive. And that's hard when we personally feel offended by someone's words or actions. So similar to the story I just shared with you, we allowed and gave the space for that student after we had caught our error to share their story if they wanted to, which they did. And we did not silence them. We did not compare stories, and we just offered validation and empathy. My friend, also clinical psychologist, Dr. Michelle Wong, said, we want to think of humans as simple, but we aren't. We're complex and nuanced, and that takes effort. Sometimes people don't want to put forth that effort. So we could have taken that story and just reduced it to something really simple. Oh, here's a student who's a war refugee, right? But then when we allowed her parents to share her interests and her experiences and how she struggled not being in school for 2 years and how she was excited to be back in school, it took more work for us as a whole team, the staff, the teachers, the clinicians, but we were able to create a better welcome plan for her to be integrated. We started a lunch bunch for students to learn about her culture because she was interested in sharing about her culture. And that took work, but we were willing to put in the work. And lastly, one of my colleagues and friends, a school psychologist, Dr. Kendria Hart, said, default to compassion. Kendra works in a high school predominantly with newcomers from Central America. And she said a lot of times teachers will say, well, I didn't know the student went through that. And so that's why I gave them that negative consequence. And so she always says, default to compassion. You don't need to know someone's story to be empathetic and show them the supports that they need during a difficult transition. And you can just assume that if someone is expressing some difficult or maladaptive behaviors, you can offer them support without even knowing their story. So I think it's important knowing how, when, and to whom to tell your story. I work a lot with suicide prevention, and it's a really sensitive topic. And I think when you have lived experience, we're very conscientious of of delivering details of a story and making sure that our listeners are ready to hear it, but also that we're ready to tell that story. So again, we shouldn't coerce anyone to tell their story, but we also shouldn't silence them if they're ready. I had students when the war in Ukraine started who, if they knew that I was from Ukraine, or my colleagues reached out to me when they knew that I could possibly offer them support. And they said, what can I do for the student who's an immigrant from Ukraine? They're now feeling very triggered or activated by what's happening there. What can I do? And I said, okay, we talked about validating their feelings, let them share their story and what they're feeling right now, what is triggering them. And here are some opportunities for activism that I have heard about, but also ask them, brainstorm with them. What are ways that they would like to support either someone in Ukraine or maybe others who are in need right now in their community who are impacted by this in other ways? Like I said, you can connect even if you can't relate 100%. So recognizing that I have my own experiences, but that, and just because I haven't gone through everything that my students have gone through doesn't mean that I can't support them or listen to them or relate to them in some sort of way, or even just validate their feelings. So do not make assumptions. I've had, and now from a personal perspective, I've had many people who know that I identify as Russian, but maybe didn't know that I'm from Ukraine, make assumptions about how I feel about the war in Ukraine, or make some sort of comments or kind of be a little more cold toward me when the war started. And so it required much more work on my part to explain to them how I feel about it. And that even if I weren't born in Ukraine, I can still feel for what is happening there. So it's just important to have that dialogue. And I had to advocate for myself because some of my colleagues didn't know how to support or address that conversation with me or with our students. And consider someone's strengths. Don't assume that just because someone is a war refugee, they don't have anything to bring to the community or we're there to save them. Right? It's really important to recognize that they're coming and we can learn from them as well. They may need support, but it's a reciprocal relationship. And finally, recognize that there are different phases. There's active distress, resilience, and a topic I'm passionate about, post-traumatic growth. And our students may come and go in the different phases, but we need to recognize that maybe they're not ready to grow from an experience yet while they're actively in it.
My name is Stephanie Noriega, and I am a social worker, a licensed clinical social worker, as well as the program manager for a newcomer wellness initiative in Oakland Unified School District in Oakland, California. What brought me to the work is both life experience and training. I've been working with newcomer families professionally for about almost 10 years, but it's been my entire experience since growing up. I come from a mixed status families, so I've seen firsthand the implications of not having the access to resources or understanding how to navigate certain systems. I have experienced the lack of access due to not knowing how to support, how to navigate the resources and the systems. And so missing out on opportunities because of fear, because of misinformation. And so I quickly realized that I wanted to help my community. At first, I thought it was going to be my small community of East Palo Alto, which is where I was born and raised in California. And then I quickly realized that it was just, it was larger than that. And so being able to understand and support families on a larger level was really what drove me to go to the School of Social Work, to really understand how to organize my work and my thoughts. And so slowly but surely, I started trickling into different organizations, first focusing on mental health and then really focusing on coordination and program management of the different types of services. I realized that social workers don't often have a space to organize themselves. And so being able to do this with a population that's extremely vulnerable was something very special. And I realized that schools is where a lot of our recently arrived families spend a lot of their time in, because in their home countries, they might have not had a requirement to spend this much time in a school setting, but here in the States it is. And so being able to create a hub of safety was, or a hub of being able to meet their needs was really important for me. So yeah, it's a little bit of how I ended up in the work. And so through my presentation, I'm hoping to show a little bit of what the initiative that we created to support newcomer wellness is doing. It's still 5 years young. 2 of those years were in pandemic. So I feel like as soon as we were getting into the groove of things halted and we had to reshift. And so now we're like doing the whiplash of what it means to come back in person. But we're slowly but surely getting into the progress of, being able to continue and build. So next slide. So OUSD has had supports for refugee and asylee families since 2007. Its primarily focus back then was for students and families arriving through overseas resettlement programs, and not so much those on who were claiming asylum here. Since our demographics have changed as migration from Central America increased, there has been a shift, a focus in it. Our focus, shifted from to the Central American families, particularly unaccompanied minors or families who are seeking asylum and refugee here. And so our staffing and our programming has expanded to provide case management for these students, particularly in 2014. Again, our demographics have changed. We do still see families from what you call the traditional war impacted areas like Afghanistan, Yemen, Iraq. We recently just saw our first Ukrainian family, but the numbers have dropped significantly due to the high cost of living here in Oakland. So families are still very heavily resettling in California, but Oakland is not the #1 target as it was in the past. So even though we do still see these families coming through resettlement programs, they have a lot more heavier support from transitional programs than our other families who are coming here seeking asylum and refugees. So we have decided to also focus our services on those, because even though they're not what I call your traditional war impacted, they still do experience that. They do come from war impacted environments. In response to the glaring needs, we created this outline for our work. The goal is to address, the goal of the work is addressing the fact that in order for schools to prove intention and retention rates of newcomers, they need to be sure that the information and systems are set up to properly respond to their needs. Our goals consist of trying to connect families to case management and eventually mental health services, while simultaneously trying to improve the culture and climate at schools and be more welcoming and inclusive of newcomers. This role isn't your traditional clinician or school social work role, because we do want our social workers to go between all of the tiers to be able to truly address whatever's coming up at the time. So we didn't want them to just have a caseload and then just be stuck behind a closed door doing therapy, when we knew that there was tons of crisis interventions, tons of secondary or vicarious trauma that was bringing up things for students in the moment, whether it was in the classroom or on the yard, whatever the case may be, but also being able to help the school understand the students that were coming into their schools, because historically that wasn't something that they really understood, especially when these large waves started coming. It was just, they felt inundated on top of whatever they were experiencing at the moment from their own particular needs, given the geographic location of Oakland. So the newcomer clinical social workers are the ones who we call the wellness team, but their focus is primarily to address their basic needs first, as a way to both build trusting relationship, as well as create conditions in which mental health services can be a benefit to the students. We quickly found out that these families do not have a stable base. And so therefore they will not be able to work on their mental health if they're only worried about their physiological or safety needs. The lack of these needs can cause secondary trauma and triggers from families from their previous experience. So trying is the key word, to stabilize families from this approach felt like a more immediate impact, because not only was that what the family was asking for, but once we started letting them know that we were addressing or slowly removing some of those barriers, they were then able to say, like, I'm not able to sleep, I haven't been able to eat, whatever the case may be. And also just on a systemic level, a lot of these families can't even get access to any mental health services if they don't apply for the proper public benefit, which would be able to afford them the access to mental health, the access to medical services, whatever it is, to be able to get these physiological and safety needs out of the way to be able to focus on themselves internally. The hope is that through this practice, it would slowly eliminate any secondary trauma through this practical practice. So what ends up happening is that we end up having a two-part intake, because newcomers enter the school district at all times of the year. It was a strong request from schools to be like, can you give us any information on these students? And so we first created one, since all of our students here in Oakland come and register at our enrollment center. We decided, and once upon a time we didn't have social workers, we decided to create a central intake, which was what we would call the offer first, or offer resources first. At that moment, we weren't asking, where are you coming from? What is your story? Like any of that. We just gathered basic information, and it's more of like, do you have access to medical? Do you have books? Do you have a secure place for food, or whatever the case may be? And it was for us offering these things first that the families really did feel like we were invested in them and in their success. And so then when they showed up at the school sites, it was a small win for some of the schools to not have to worry about them being connected to Medi-Cal, or not have to worry about kids not showing up with the proper or basic school supplies, because the families a lot of times came here with nothing. And so being able to do that then allowed the schools to really focus more on what the student and the family showed up with, to be able to wrap around them holistically. And so then that once we started having social workers on our team, that's the second detailed follow-up, where they would definitely ask about historical information, education, medical. It was then, now can you give us information again to wrap around? But the families already knew that the reason why we were asking this information was to really understand that we were offering services to them. And so building the relationships then with the schools and the local community-based organizations was super crucial, to be able to then come together and engage the family. And this would ultimately, the hope is that this would allow the family and the student to just be a student and present while in the school, because they knew that there was a social worker working with their mom on finding a job, or the kid, this was the safest place for the kid, because they knew that that's where they were going to get their meals, whatever the case may be. So it was a little bit of a twofold to be able to do it this way. And I'm looking at time, so I'm going to try to do this quickly. But the slide, so then that eventually helped inform our practices, our micro, meso, and macro practices. From a micro level, an immediate offering was that the site had information on the student. They weren't coming in not knowing who these students are. They helped shape cultural considerations as the site leaders can use to later inform teachers and admin on how to support these kids. They help identify referrals and are needed to ensure that students are getting the holistic support. From a meso level, it also helps identify the mental health support needs, especially when informing groups or individual classes or workshops that the students may want to take. Out of this connection, and with the support of other departments like the Office of Equity, affinities groups based on cultural background or languages definitely were created. And in these spaces is where the students had the opportunity to share what they were going through, if there was any secondary trauma coming up to them. If it's not in the groups, then because they had a one-on-one with the social worker, they were then able to go directly to the social worker to share some of these things. For example, and then I'm going to stop, a lot of our families settled in Oakland, and sometimes they end up settling in parts of Oakland where there is also a lot of exposure and they're experiencing a lot of trauma due to the geographical stressors like community violence or resource deserts. And it's actually in these environments that more so than the media, where our families were exposed, experiencing secondary trauma. So when we had families experiencing that due to unexpected police raids or witnessing or experiencing community violence, they had places in which they can share that information and be safe, and also be able to know that whatever it is that was coming up for them was going to be answered and whether it's like, I just need a place to rent, or like, I have not been able to sleep, or I'm having a hard time breathing, those interactions, because of the culturally sensitive way in which the social worker wellness team was able to create, was able to support them in that way.
So my name is Jose Patiño. I come through this lens as a former educator and a current community organizer. I am a DACA recipient. I migrated to the country when I was 6 years old with my mom to join my dad, who was here. I work at Aliento. Aliento translates into breath. Aliento has been a community organization since 2016. I joined the organization in 2017. Aliento was founded by my partner, and I have supported ever since. But I wanted to, if we go to the next slide, talk a little bit about myself and sort of what drives me here. One of the things that this topic is immensely important to me, as well as overall the work that we do. We work with a lot of undocumented DACA and mixed status families. And growing up undocumented in Arizona, I grew with a lot of anger. So that was my number one. So very angry all the time. And it took me a while to understand why I was angry. And one of the things that later on I found out, once I spoke with my parents and grandparents, was that violence had been in our life from fleeing the Mexican Civil War. And that's why my family moved throughout Mexico in order to survive that and settle into a small town. And then the violence that has surged, whether at my home, as well as community violence, as well as violence within the school system itself, as well as losing friends throughout my years, my childhood, as well as seeing some people perish in front of me. And it's something that has helped me guide me through this process of how do I not only go through these emotions, but also how do we help other people, specifically a lot of as Stephanie mentioned, there's a lot of community violence for many different reasons that are the community that I work with experience on a daily basis that is re-traumatizing. So for us, it's something that we want to make sure that we help them. So one of the things that is, as I mentioned, I wanted to show a couple pictures. One of them is from me graduating college. The other one is with my parents, and the other one with at the White House, and the other one in construction. I used to work construction, so I was joking with them that it feels like Arizona right now because we're starting to have some of the heat. So this is some of the communities I work with. We work with elementary students, 5th and 6th graders. And a lot of these students that come to us are from mixed status. Most of them are citizens, but they're identified by the partnership within the school with the principal. They're students that are struggling with their education, as well as some of the behavior. And we work with them from August to May, and having monthly workshops, as well as we do our singular workshops where we bring students together and how do we process anxiety, stress, and our mental health. The other one that we work with is a lot of students who are undocumented. And as I mentioned, most of them fled through various circumstances that they had. Most of them didn't want to migrate to the US, but they were looking for better situation for their families. And a lot of those things they carry through generational trauma from their families to here, and then a lot of retriggering and traumatizing that exists. And then also with mixed status, where the parents might be still undocumented, but the children are citizens, and how do we support that system? So for us, it's always about how do we connect them with the resources that exist, but also what are the things that we can help them with. So a lot of the things that we do is advocate first for the students, for the people and the families, and then also for us to train them how they can become advocates for themselves, because we want them to be self-sustainable. There's some couple of pictures that we have for the arts and healing workshops. We have from 7 years old up until grandparents, multi-generational setting. We find that a lot of the healing that needs to happen within families and community. One of the things that we see often is a lot of our folks feeling powerlessness, partly because of their immigration status themselves, in terms of not being seen, and a lot of services that exist they're not eligible for. So for us, it's like, how do we reframe and reshift that and focus on the strengths that they have and the resources that they do have, versus focusing on what the things that we don't have. The other one is, now that we have more strength and have gone through this process, now we want to make sure, and they want to advocate for change, that we do. So for example, is we have want to advocate, whether it be at home, whether it be at school, whether it be outside, in the city, in the city council or the Capitol. One of the things that we're trying to do extremely well is processing that trauma that exists and changing the systems and structures in place, so therefore that doesn't keep existing. It's one of the things that we have heard, as many often, as Natasha was talking about, is oftentimes people want to have the sense of agency, and they want to be able to help change some of those things. One of the things that we found out 3 years of working this community, I've been involved in community organizing since I was a high school senior in 2007, was that we often, specifically, we wanted to help and advocate and change policy. So therefore we didn't go through certain things, whether it was getting a street sign at school, at the local neighborhood, or increasing the speed bumps, or certain other stuff. We wanted to do that. And what ended up happening is that we started to share our stories, and for us, like, what drove us to be here in this work. And oftentimes what happened, because a lot of that was just sort of more of a venting, we traumatized ourselves a lot. And then oftentimes when we did advocacy outside, in the media perspective, often that was the story that they wanted to see. They wanted to have individuals who were very vulnerable, that were often crying. And that's something that I have seen and witnessed myself, is that oftentimes the way we're framed in the media, if it's not something where as cynical as this says, if it bleeds, it leads, we often don't see our communities being covered. So one of the things that for us is important is there's still wars that are happening right now. Some of them are declared, some of them are undeclared, and a lot of communities are coming through these violence that exist. So we want to make sure that we don't compare them to each other, but we want to make sure that we hold space and we're compassionate for people. A couple of things that again, as I mentioned before, is that, again, war is always happening, and just because it's not in our national dialogue doesn't mean it's not present. We want to make sure that we don't internalize anger. The other one is be aware and attuned to the power of language in the media. Again, oftentimes this is something that a lot of our folks have said, and that has helped them, is to try not to see any of the coverage within the current wars, as well as the recent shootings, because that triggers them, things that have happened. A lot of work that we're doing right now, as similar to Stephanie, with a lot of asylum seekers from Guatemala and Honduras and Salvador, just because of the communities that we work with, they have been increasing numbers, is that violence that exists is a little bit different. A lot of it, it's not necessarily covered in the same way that other folks cover, specifically in school systems. And one last thing that I want to make sure that is important is that our own communities don't need saving. We need partners to support our healing process. Oftentimes, a lot of times people come into the space well-meaning, but they come through a sort of more of I'm trying to save you versus I am actually here with you to work on this journey together. And the last thing that we do at Aliento is we go through the model of Lakesh, tú eres mi otro yo, si te hago daño, me hago daño a mí mismo. Meaning is that you are mother you, if I harm you, I harm myself. So for us, we look at it as how do we work together in community with individuals who might not necessarily understand where we're coming from, but as well as build those bridges.
First, I just want to express gratitude to our 3 previous speakers. Your truth and vulnerability and wisdom just in these short 30 minutes really was incredibly moving and created, an internal shift in me that is palpable. And so I hope will continue to inform my work in this space. So thank you. And thank you to our hosts, who asked me to move away from kind of the what and the how of school mental health, which they've probably seen me present a lot, and really to think more about The considerations that I've experienced as a professional, as a person in this space of newcomer mental health and school support. So I'll share a few resources in the chat now, but then really my time for these few minutes is just going to be some reflections on the work that I've had the privilege and opportunity to do in the space of newcomer mental health and school support. So I should first just describe my entry and invitation into this space. It was really born out of my work in school mental health, more so than due to personal or professional experiences with immigration or newcomer experiences. My closest personal experience to the immigration experience really is that of my mother, who did immigrate to the US in her 30s, though it was from Western Europe and not in the context of strife or war or persecution, but really in the context of a marriage. And so while I witnessed some of her experiences as an immigrant, including not having family in the country and having a lot of traditions and even clothing for us as kids and our family that was different than our neighbors, and immediately being recognized as different based on, you know, her accent. My experience in this realm was really quite different than most of the families that I've since worked with who've primarily migrated due to experiences of suffering and in the context of distress, and their migration and post-migration experience has also really differed in many ways from my own mom, in that they experienced continued suffering in a lot of ways from their own trauma, the traumas experienced by those in their home countries and in their families, and often, you know, continuing through war and poverty and violence, but also facing new suffering here in the US and in Canada, where I've done a fair amount of this work, often related to discrimination and racism and xenophobia. So as I said, my work or invitation into this space has really been more about my work in the space of school mental health. I'm a psychologist and have worked in schools for a long time now, and worked in Baltimore City schools as well as many other Maryland schools before taking on some leadership positions with the National Center for School Mental Health, which I've been a co-director of since 2010. And also have worked quite a bit with the National Child Traumatic Stress Network in the space of childhood adversity and trauma. And in the context of that work, have been invited to do work in the space of newcomer mental health supports. In 2014, I was invited by mental health leadership to go to Ukraine and Lviv and Kyiv and support some of their students and families in schools who were really struggling in the context of the Maidan Revolution, also known as the Revolution of Dignity. And so we work with their schools in that context, and I've been able to continue working with many of the mental health leaders and school systems in Ukraine through an initiative they have called Mental Health for You. And then back in 2017, I was invited by School Mental Health Ontario to engage with them in the context of their school support in the context of the Syrian refugee crisis, and worked with their newcomer community for years, continue to work with their newcomer communities in the co-development process of school supports, and specifically an intervention called Strong. I think I shared some information in the chat. And the interesting thing is that that was really born out of a request initially to come in and provide some support in interventions that had already been developed, but very clearly early on in discussions with the newcomer communities, the idea shifted to developing an intervention that was born out of the newcomer community, that focused less initially on trauma, more initially on the experience of students in terms of their migration process, and building connections between each other in the school. So that's my introduction to this space. And so I come to this work in some ways as an outsider and want to acknowledge that, but it's brought its own set of considerations. So I just wanted to touch on a few of those. And on the next slide, I have the start of some of those considerations. So in a recent meeting of our Strong intervention leadership, one of my colleagues, Huda Hussein, who's the student equity profile lead for School Mental Health Ontario, was talking about how really in the trainings that we do with school mental health clinicians in Strong, that we need to better incorporate assessments and training in the space of self-reflection. And she simply stated, when we're working with newcomers, we really need to be effective. She said, we must be reflective to be effective. And we all appreciated the simplicity of the statement. And so when asked to do some speaking today, I thought about, well, what are some ways that I've reflected myself? And here's 3 quick ways. First, of course, we know we can't do this work well without a lens of cultural humility. And for me, this was not just about learning about the experience, for example, of Syrian refugees or Ukrainian refugees, though it did involve significant reading and speaking to newcomers and families from those communities. But it was also really understanding my own beliefs and values and how people have lived now and in the past in their own countries, and the legacy of my own ancestors towards groups and individuals. And this work was done in big and small ways, from reading to watching documentaries, but also having conversations with my own father, born and raised in Texas, about our family's contributions to racism and violence toward Mexican Americans and African Americans, and how, as a family and culture, we had benefited from the suffering of others. Second, an area that I often think about in this space is the why of the work. That's how I talk about it. And by this, I mean, why do I feel called? Why do others feel called to support refugee and immigrant students, especially if we are coming from a place of an outsider, so to speak, or without that lived experience? And when I think about this reflection point, it makes me think about some of the work that we've done in the context of mass violence in schools. I vividly recall someone who's now become a close colleague from Newtown, Connecticut, close to where I grew up, and where I've done work now for several years since they experienced a shooting at Sandy Hook Elementary School. And she said, we know there's people who come here so that they can tell others that they're helping us, or to add a line to their CV. And I think many people without lived experience of immigration, and even some who have had that lived experience, may be guilty of this phenomenon, right? So our privilege of being a professional in this space opens up opportunities to support communities who are truly experiencing suffering. But it requires us to ensure that we're not simply helping so that we can add to our own experience or tell others that we're helping. While we'd all wish to believe that our supports come from a place of altruism, there's really sometimes more selfish motivations that may be driving us, even at a subconscious level. So it demands that we reflect on this, I think, is the point that I am trying to convey. And beyond that, many people have a desire to do something in the context of human suffering. Many, of late, what can we do to help the Ukrainian refugee crisis? Yet, I still in this context had to reflect on why I'm doing this work, and was, I did go visit at the request of colleagues I'd worked with internationally in Poland for some time. I was in Poland in March and April of this year supporting the refugee crisis, but had to ask myself this, is this because I feel like I need to do something helpful? I appreciated Jose's remarks about, saviorism, right? Or is it because what I'm going to do will really meaningfully contribute to the problem? And these questions are hard but necessary. And then a final point of reflection here is really around our personal roles. And this was something that became really striking for me in the most recent work over in Poland, where we were working with many helpers and many mothers and children who are coming from Ukraine. And I was working with a colleague who had worked in many refugee situations in war-torn countries, and yet she seemed particularly shaken, and talked with us about how she was feeling quite unbalanced and was trying to figure out why. And then she reflected on the fact that this was the first time she had done this work as a mother. And the picture you see here is actually a picture of all of the shoes that sat at the entrance of one of the homes where the Ukrainian mothers and children had come. And I think it took many of our breaths away But really, it's important, of course, for us to reflect on our personal roles and how it impacts this work. I recognize that my time may even be close to an end here, if not ending. I'm trying to look in the chat box. So Yasmina, feel free to cut me off. A couple of other very quick reflections on the next slide. Listen first, then speak. I really appreciated Natasha's comments around this, so I don't want to be redundant here. But this picture here was of us working with some of the children in the context of the work over in Poland recently. And, you know, I think the colleague I mentioned earlier who was feeling, you know, not quite herself when she came into this work, jumped quickly into content and then paused and stopped herself. And really, we took then the time to hear in this particular space with a group of newly arrived Ukrainian mothers what they needed, what they wanted. And there were children who the hosts were trying to keep in a separate room, yet they were experiencing so many disruptions to attachment. They wanted to be with their mothers. The moms were really saying they needed respite from childcare, and at the same time were feeling very self-conscious about some of the new externalizing behaviors that their children were experiencing. They felt they were being judged as mothers. So it really transformed the content of what we spoke about, just to take that time to pause and listen before speaking. So I won't go into more on this slide. The final slide, actually, I have to say, really speaks very much to some of what we heard earlier about we heal as a community. I think that was in Jose's slide. And this quote actually about loneliness comes out of the Surgeon General's book, Together. And, you know, he speaks very much about that we heal in communities and we thrive in communities, and we all have different levels of need when it comes to socializing and engaging with others. But that I bring this up because one of the major things that I'm always kind of stunned by in the work that we do is how much we focus on healing the individual without leveraging the collective, you know, strengths and support of the communities in which they reside. And I think that's true not just in terms of the interventions we develop and, you know, try to implement within refugee and immigrant newcomer communities, which is why we need to turn more to culturally based interventions. But also for us as helpers, we so often just prescribe self-care, and thankfully folks are attending more now to collective well-being and organizational well-being.
Jose, one of my first questions is going to be to you, in seeing all the different ways that you said specifically helpers, like folks can help. What was your first reaction when you heard about when you saw what Stephanie was sharing about the newcomer program?
First, thank you, Stephanie. I was amazed and I was a little bit jealous, to be honest with you. I see places like the work that Stephanie's doing in California and Oakland, and I want to have those things, opportunities for the kids that I'm working with, the kids that I see every day. One of the things that is very transformational, it gives us at least a direction where we're heading. Because oftentimes, I don't know if all of you have experienced the same, but it can get very, very defeating, very like we're not making the progress, or you often hit more walls than you actually have all these breakthroughs. So hearing about this, something like, oh my God, like this is possible, we can get there, we can work towards creating something different. Reform the systems that we have. It's going to be hard because we have very, very difficult systems and structure in place, but it gives me a lot of hope.
So Stephanie, I'm first going to pass this question to you, and then anyone else can feel free to jump in. Therapists, peer specialists, social workers, adapt something that they have or look at something they have differently to ensure cultural humility and responsiveness.
Kind of laugh at the fact that people say that our program is so developed, because I'm like, we are still struggling. And it's also very like humbling, because it's not until I get into these spaces where I do recognize that Oakland is like a very unique bubble. And so I often have to remind myself and also my team that change is slow. And we're asking, at least here in Oakland, asking the system that's not even working for the kids who was it intended to create for, to then now think about these new kids who are like coming with 10 times more different things, not more or less than the ones that are already here, and then adjust your entire system that was fundamentally not even working for the kids here and do something about it. And so I always say, like, our program, our initiative is 5 years young, and 2 of those years were in the pandemic year. So I think for us, it's like this constant work of like, we have leaders within our agents, our organization who are like, we believe in this. We don't know how it's going to work. If we give you pushback, it's not because we're not intending. It's just like all these other mitigating factors that we sometimes we have control over and sometimes we don't. And so in that same perspective, from that same, we ask folks to constantly come from a learner stance, to constantly like listen more, ask very little questions, because if we do have a kid who's coming or a family who just told us, you know, the police just accidentally raided my room and it brought up like all these things from my home country, and then they just left and didn't apologize, like all these things, it's not a place for me to be like, oh, well, tell me how it was in your home country or help me understand. Like, no, it's just like, I'm sorry that happened, that validating experience, validating that trauma that it could have definitely brought up, and then coming alongside the family. Like, did you just want the space to vent? And then I'll check in on you later to see if there are any follow-up steps, or do you want me to do some type of follow-up? Like, how would you want me to show up for you in this space, in this moment? And I think that's why it's crucial for us to have social workers, particularly clinical social workers, who are doing this work, because of the best practices that come with that training. Because that, even though we're asking what case managers or basic questions can be asked, we are using clinical techniques to be able to check in, to assess, to see when a kids' cortisol levels are up here and how do we bring them down here to a baseline, or to see if there are any grounding techniques that in the moment we can do alongside them. Also, very much for ourselves, because then we experience the secondary and vicarious trauma of the anger, like Jose was mentioning, of like, this should have not happened. How did this happen in this country that they came and supposedly was supposed to be a better life, and unfortunately where they decided to settle, or not even decided, where the only options of where they decided to settle are the deep East Oakland, west side of Oakland, who already are experiencing a lot of marginalization within themselves. So I think it's a little bit of a both and, like, both recognizing that even just in hearing the stories, you're learning a lot. And in those moments, it's not about questioning the practical of like the cultural nuances that we need to understand to like be able to feel like we're serving in a larger way.
Thinking about what you said with making the student feel welcome, as well as the registration forms and all of that. One of the schools that I visited in Baltimore, they also had many refugees, and they made the whole family feel welcome. So they, as soon as you would enter the school, at any time they had a family come from a country where they didn't already have a student, they would have things in that language on the wall, right? And in the office, I thought this was really simple and made the families not worried. If the parent was illiterate, they would sign the parent in instead of making them like try to figure out how to sign in. Or if the parent didn't know how to write in Latin letters, they would let them sign in their language. And then, the school staff who are welcoming them knew who it was, right? They asked for ID, and they would just in parentheses put that parent's or guardian's name next to them. And I just thought those, again, really easy steps welcomed the whole family, didn't humiliate anyone, and really made the students feel welcome. One of the things that I did at my school was I got a grant and I purchased books in varied languages. So we had students from Eritrea, Nepal, Syria, Congo, and I asked them, what language is because those countries sometimes have multiple languages, and I would try to find books that were bilingual in English and the other language, and we just added them to the library, and they stayed there, and kids could pull them out, and even if they don't know how to read in their parents' language, it was there for them. They could check them out and show them to their parents. So making that homeschool collaboration.
I love the point, Natasha, about leveraging the library. So if you're an educator or someone who works with, hopefully your town has a library, librarians are the unsung heroes of newcomer welcoming and of mental health, because library is one of the few places that does not cost to go, has free internet, and someone who will help you navigate how to look things up. And in many of the communities and cultures in my state, which has 22 federally recognized tribal nations, language erasure was a on-purpose policy. With that, I'm going to transfer into our last question. How might we as providers hold our own biases as we engage with war-impacted people in general? Trying to explain DACA, even just trying to explain what services you qualify for and don't qualify for, that's the other thing I heard.
I think just in my experience, kind of what Sharon did, just saying, I'm unfamiliar with your culture, and I know there's a lot of conversation about not burdening the person, but gauging, because there are people who want to talk about their story. And so just gauging the space that someone is offering to you. If they don't want to talk about it, don't pressure them, right? Because we don't want to burden them. But if we want to learn from a personal experience, someone is really wanting to share their story, make time for them. Because I think it's really hard a lot of times, especially in the school setting. I don't have time. And making time for a student or a colleague, especially colleagues, to offer if they're willing to share, and just saying, I don't know, right? You don't know everything, and that's okay.
I think one of the things that I have to constantly remind myself, and as well as others, is that even though I have shared experience, I come from, like I said, a mixed status family. I do not assume that my experience is the same of the families in front of me. And so constantly being able to kind of step back and let them lead those discussions, it's even more crucial now than ever, and assume nothing. Assume that not because they live down the street from where my grandma used to live, that their experience was the same as mine. And then for those who aren't part of the culture, not lumping them together. There's a lot of similarities and familiarities, but there's always these uniqueness, and really trying to pull on those uniqueness and keep that at the forefront of your mind. And really, instead of coming from, tell me why you left your country, it's like, tell me what you missed. Tell me what you're bringing from your country, like this strength-based, asset-based perspective, only because, again, here in Oakland, we're seeing a lot of Mayan Mum Indigenous families, and then it's similar to what I can't remember who said it, but this intentional erasing of language. It's the same thing for the Mayan Mum families who we're seeing. They definitely experience marginalization on another level. And so for us, seeing that we kind of now can distinguish when a family is Mayan Mum speaking, but because of all these intersections that you're mentioning, they don't say it. And so for us to assume that they're literate, they're not literate, that they don't, we just really take their, and even if they do hide it, we understand that it's not, because it's more of a safety thing.
We're going to say thank you and close.